Thank you all so much for joining us here today. It's such a treat to be at the Aspen Ideas Festival, and it is appropriate, I think, that we are talking about climate change today, especially in this location. I mean, anyone who has been here in the summer looks up at the mountains at this time of year and sees snow that is still there. That snow is no longer up there. We know we are also in the middle of a tremendous drought here in the West. I spoke with a man yesterday, a 55-year veteran of Aspen, and he said that he had never seen the river running quite so low. We also have dozens of forest fires that are burning all over us, surrounding this area right now. These are all symptoms of climate change. They are not driven by human activity, but these are the flashing red warning signals that this is a real problem facing us. We know that climate change also has a huge impact on human health. And that's one of the things that we're going to be talking about today. The medical establishment's recognition of this as an issue and what it is doing to try to address that. We're also going to be talking about how the healthcare industry is recognizing that while it is trying to protect people from the impacts of climate change, it is also a major contributor. The way in which we practice medicine in America is a contributor to climate change, and there are ways to make that better. So we're going to be talking about that as well. And for that conversation, we have two perfect people for that. At the far end here, Victor Tsao is the president of the U.S. National Academy of Medicine and vice chair of the U.S. National Research Council. Previously, he was chair of medicine at both Harvard and Stanford universities. And Lisa Patel is the executive director of the Medical Society Consortium on Climate and Health. She is also a clinical associate professor of pediatrics at Stanford University's School of Medicine. Welcome to you both, and thank you so much for being here. Victor, I would like to start with you first.
Yeah.
Could you help us understand, was there a moment, was there a period of time when the medical industry started to recognize that climate change was a real problem, that it made us humans sick? When did that happen? How did that happen?
Well, I would say that to begin with, our community have looked at these issues of extreme heat, extreme events as an environmental issue. Wasn't until because we've always taken care of patients with these issues, right? Air pollution and respiratory disease, asthma, you name it. But I think in the 1990s, the association between climate change and these events were very clear, or getting increasingly clear. So my feeling is the major leap forward is the last 15 years or so, when Lancet had a commission on climate change and health. And then 2015, there was a Lancet commission that became the Countdown Lancet. Now, Lisa's going to tell you about her medical society, but for us in national academies, about 2017, became fairly clear that, boy, a lot of issues we're dealing with in health are related to climate change. And consequently, we have members who got together and talk about what we need to do. We start planning in 2017. We launch a grand challenge in 2020. And I can talk more about what the grand challenge is. But we see this issue is not just an issue of, well, it's first an issue of health, by protecting health, preventing disasters, our role and responsibility. But also, as you mentioned, we also emit a lot of carbon in the medical sector, what we need to do. But I think more importantly is engaging policy, getting to be sure that all aspects of decision-making in climate, energy, has health center in their thinking. Because while many industries like agriculture, transportation, energy, look at what do we need to do to mitigate emission, they don't think about, are these decisions making a difference in health?
Right.
So those are the kind of things. So the medical community is all in. Now, looking at the size of the audience, we have a lot to do with the public. AI was drawing all the audience. I went to GLP-1, all the audience. Lisa, we have a lot of work to do.
Lisa, from your perspective, that sense, was there a moment, again, from your perspective, when did your community start to realize this is something we have to tackle directly?
Yeah, and I came at this a little differently than Victor because I was actually an environmental scientist first. And so I've been studying climate change for 30 years. And then I became a physician, and I remember thinking I would have some time to learn how to be a good doctor and my kids are in the front row, learn how to be a good mom. The wildfires, I live in Northern California, the wildfires started to hit. And I started looking around. At the time, I had no leadership positions in climate change. And I started to look around and try to find other physicians or nurses that were working in it. And it wasn't readily visible to me. I really credit the youth movement in 2018 and 2019 that really just brought everyone out. The Medical Society Consortium itself was founded in 2017, but what I noticed was that there was this huge momentum around that time, I think between the youth movements and these crises that were getting worse. I call myself an unfortunate wildfires expert. This isn't what I dreamt of being when I was a little girl.
Right.
But I was an environmental scientist and a pediatrician, and we were seeing so many people trying to make sense of what wildfires meant for their health, that this was an area that I became an expert in, and I saw that happen in lots of different areas and fields, emergency medicine physicians becoming experts on extreme heat, infectious disease doctors becoming experts on how vector-borne illnesses are changing. So to Victor's point, we started to see those impacts, and the profession started to learn as we go to try to bring that awareness to the work that we need to do.
Can I say what?
Please.
I think frequently we think about climate change at these events, but truth of the matter is people are dying from chronic disease, respiratory disease, cardiovascular disease, mental health, infectious disease, from air pollution, right? From many other events, about 7 million people die a year globally from air pollution. That's climate change.
Right.
So while we think about these dramatic events, which is so important, we talk some more about this, we need to remember that the real impact in climate change is on these issues of asthma, respiratory disease, elderly, all the stuff, which are chronic diseases as well as acute diseases.
I mean, I've heard from environmental and climate experts for years making this argument that even if you do not care about climate change or the glaciers or sea level rise, that simply tackling air pollution alone would be saving, as you're saying, millions of lives every single year in premature deaths. Victor, I wonder, as someone from your position, was there any skepticism in the medical industry to acknowledging that this was a real issue?
Honestly, not much. I think it just became issue awareness, right? Most people were not aware this was an issue. I think what's exciting, what Lisa said, is around 2017, 18 is when people begin to realize this issue, and a lot of people working on it. But it is until we organize ourselves as groups of people, organizations, to say we need to do something about this, which, by the way, is so important, the communication to the public is so important. And I'm sure Lisa will talk about how we're training our doctors, nurses to be sure that they actually make patients aware of this issue, particularly when we see extreme events, but even chronic events such as this. So actually, I've not encountered, if anything, I've had a lot of people saying, you're not doing enough, right? So the good news is through the work of Lisa, many others, I think most medical professions are aware of this. The issue in pushing back is going to be how much work do I need to do? Hospitals say, wait a minute, I got enough to worry about. Do you want me to measure one more thing?
Right.
Do you want to do all those things? Those are the issues that we can talk some more about.
Lisa, to Victor's point, if I was a young medical student today and I came out of medical school, or even compared to, say, 10 years ago, are doctors being trained to be focused on this, to be aware of this, to see those linkages that you're talking about?
Again, the credit I really want to give here is the youth movement and what we've seen in medical students. I would say they have been really the soul of a lot of the work that we've seen happen. And so around 2018-19, there was a group called Medical Students for a Sustainable Future. They created a planetary health report card, and it has spread throughout the country. And it's been a way for them to leverage to their medical school what their grades are in terms of teaching planetary health. Now, are we as far as we need to be? No. But thanks to the work of these medical students, more and more medical schools are integrating planetary health into their curriculum. So I would say actually that part of training is well underway. What Victor and I are working together with through National Academy of Medicine is dealing with all of the folks that are after training that are much harder to reach.
Yeah.
And we're doing a big session in the fall to really try to reach that population.
And how do those sessions go? I mean, again, to Victor's point, is everyone saying, oh, of course this makes sense, of course we need to start doing this? Or is it I don't have time for this, I'm focused on board certification, all of those other things?
So I love Victor's optimism. I've encountered something a little bit different.
We have an optimist side, we have a pessimist side.
I call myself a cynical realist. But what I've encountered in a lot of the talks that I do, especially in the community, is that there is a segment of the population in medicine that denies that it's happening. Now, it is the minority, and we know this from the polling research, is about 10% of the country. It does show up in medicine in different ways. But the other thing that I hear, and I work in a small community hospital, we are dealing with if not broken, then breaking healthcare system. I'm in pediatrics. 30% of beds in this country for children are gone. I have
30% of beds
for children in hospitals, because community hospitals are closing their pediatric wards. And so what happens, especially during high pressure times like respiratory illness or big air pollution events, I have had to call to Nevada to get children transferred because there are no beds in the Bay Area. This is the Bay Area, right? And so healthcare already is under significant strain. We have not recovered from the pandemic, and we are going to see more pressure from climate change. So to your point, what I often hear from providers is not one more thing. I cannot handle one more thing. And this is where I think sustainable healthcare is actually a really good way in, because the way we talk about sustainable healthcare and what I have felt from healthcare providers is that it addresses moral distress. It helps people have a sense of agency again, that your healthcare institution can be part of the solution of healing rather than just feeling like you have no agency or control over the system.
Please.
Lisa's so right, but I do want to point out it's actually the ambulatory outpatient community care that's than hospitals about these issues, right? So hospitals are overwhelmed. I agree, they've been cut back. But I think we want every clinician, every healthcare worker to be aware of this, because they're the ones who's going to deliver the care, not the hospital alone. So while I agree with her concern about closure of hospital, which is a terrible thing, our country, that's another topic altogether, right? But I do think reaching healthcare workers frontline, reaching the community health workers, reaching the non-MDs and nurses are key in being able to take that out to the community, because most of what we're dealing with, to my knowledge again, is these chronic events, also heat events, in addition to extreme events.
Yeah, I was just reading a study from Harvard that indicated that 4 out of 5 staff at frontline clinics, just as you're describing, reported climate-related disruptions to care. And that could be power going out, staff shortages, facilities being closed, transport being disrupted. I mean, it seems like the people who are on the front lines of this are starting to understand, because they're seeing it happen all the time.
And I experienced at least 2 of those events. The power got cut at our hospital 9 o'clock at night. It was a high wind advisory, which is a big risk for fire. PG&E just cut the power at our hospital with no notice. And so we entered a blackout. I work on the maternity ward, and so moms who had just delivered their babies were just walking around in the pitch black dark. And this was a minor event, mind you. My colleagues up in Santa Rosa, they had to actually evacuate their hospital because of oncoming flames that engulfed parts of that hospital.
Victor, could you tell us, you were mentioning before some of the things that the National Academy is doing on this front. Tell us a little bit more about that.
Yeah, I see this as a huge existential threat to our health, to be sure, and I can give you numbers. I already did 7 million deaths from air pollution, you name it, right? So it's a real big issue. So I think this issue cannot be solved by one sector alone, right? imagine you're thinking about hospitals and healthcare workers, but major part of the emission from the health sector is supply chain, right? Pharmaceutical industry, suppliers, you name it. 70 to 80%, right? You probably know the numbers. That is that in the US, the health sector emits about 8.5% of total carbon. That's huge.
Huge.
But when you start looking at where it's coming from, no question, hospital, and we'll talk something about this, but 70 to 80% comes from actually upstream and downstream, which is pharmaceutical manufacturing, supply chain, you name it. So my feeling is unless we get everybody engaged, it's not going to happen enough. Sure enough, we need to get our doctors, nurses educated. Sure enough, we got the hospital ready for emergency, but you're not going to have enough impact. So a big thing what we did is called the Grand Challenge, which is bring everybody together. Medical Society is one of them. We bring together public, private sector, pharma, supply chain, you name it. Jeff Thompson's part of the initiative. We bring together, of course, healthcare workers, educators, government, really important. In our last iteration, we had certainly Rachel Levine, others involved, and of course, John Balbus from the Office of Climate Change Equity under the last administration. So everybody's coming together to say, how can we work on this together and make a difference? That's the grand challenge. We have 5 pillars. We have a huge program. One is, of course, looking at how to communicate to the public, right? We have a lot of work to do. And I think Lisa's right. Public tend to understand, and they see the extreme events more visibly and respond to it, but we need to communicate to the public. Second, of course, is looking at what the health sector should be doing, resilience. How do we create a health sector that is ready, prepared for emergency, as well as long-term efficient?
That doesn't have a blackout like Lisa's describing.
That's right. And how do we work with communities to help them be more resilient, right? Third, of course, is research innovation. What kind of research innovation do we need to do? We publish a whole report on what are the future areas of research innovation needed with Kaiser Permanente. Another one's looking at communities. We have a program that actually looks at communities. We look at mapped all the counties in the country, looking at what are the communities with the highest risk. They're usually highest risk in terms of the kind of extreme events, but also socioeconomic risks, marginalized community. And we brought them together, and we now have one that have them co-design solutions. Not us going to say what you should do, much of what she's saying about what do you need and how do we help you. And there I can come back to a lot of work. And then finally, we're doing what they call systems transformation, getting together other industry, agriculture, transportation, construction, energy, you name it, to say, can we work together and policy to put health in the middle of all those things? So it's a big initiative. And a lot of what we talk about today is in the collaborative initiative on health sector.
Lisa, do you think that some of the, I don't want to point fingers here, but the slowness of our societal response has been in part because the people who suffer the most from the impacts of climate change are not the people in power. The people who are wealthy are able to shield themselves in some way. Do you think that that has contributed to some of this?
I think it's 2 things. I think that the fossil fuel industry, who's known since 1960 with great accuracy exactly the problem that would happen, rather than start making those investments then to give us a thoughtful time and a thoughtful transition to renewable energy, they sowed mass disinformation, mass denial, paid off politicians to look the other way while we continued investing in fossil fuels at the expense of renewables. So we can't talk about this crisis without talking about the role of the fossil fuel industry. And what frankly makes me upset is that now we are in the midst of dealing with these types of extreme events where this is not, I run codes on children. The time to prepare for a code is not in the middle of a code. The time to prepare for a code is well before it.
A code is an emergency declaration of a...
So if a child comes in at death's door or essentially dead, it's the same as an adult, right? Everybody comes in and you're resuscitating that child or you're resuscitating that adult. And so that is not the moment when you figure out what needs to happen. You need to do that well ahead of time. And so what I feel anger about, especially on behalf of my kids, 60 years we had, 60 years to get this right. And now we are in the midst of dealing with crisis after crisis where we're going to have to figure all of this out at the same time. But the second point you raise is true. And I've seen this play out in the Bay Area on very hot days, very smoky days. My children are in San Francisco Unified School District, where the schools were built for a Mediterranean climate. They don't have HVAC systems. They don't have air conditioning. And meanwhile, the private schools in that same area are completely buffered from all of these impacts. So yes, if you
With
have
air filtration, they can stay inside all
air
day.
conditioning, right? Greener spaces that they have access to. So absolutely, what the climate change crisis is a crisis of health equity, of the haves and the have-nots, and the systemic disinvestment in basic infrastructure, whether we are talking about a working sewage system. I was speaking in Baltimore, and they had flood events driven by climate change that broke some of the sewage systems in disadvantaged neighborhoods. Feces were backing up in their bathtubs and their sinks, for example. Right? So there are 1,000 examples like this, whether we're talking about sewage infrastructure or access to air conditioning or green amenities as well. Having access to trees significantly cools things down. In Phoenix, there are people, especially those who are unhoused, who are sustaining second to third degree burns from just falling on the pavement. So my colleagues that work in critical care medicine are saying that the burn units are filling up from just falling on the pavement, right? And so this is where we are. We've created a system where some people have the money to stay safe. The majority of this population does not, and we are now in real time seeing those consequences play out.
Yeah. I totally agree with her. I always said that people talk about health equity is a social equity issue, right? And this is one example. But this is why these stories are so important, because people see climate as something happening here, happening there. They don't realize happening to their health. And every day, even if you're in Aspen, you're having effects of climate change, right? But if you live in New York City or in Phoenix, Arizona, you can see a lot more. I think that message should be out there, because to get the public understand the importance of climate change is not just an economic issue, it's not an environmental issue, it's a fact, human suffering. Those stories need to be out there, and you can help us with this, William.
There was a recent gathering of former health and climate ministers in Europe, and they got together and they were urging the World Health Organization to declare climate change a public health emergency on the scale of monkeypox or Ebola or COVID. Do you think that kind of international alarm signaling would be useful, Lisa?
I would have said yes once upon a time. I guess
This is back to being the pessimist side.
Well, it's more that I think there's just signal fatigue across society. There are so many, and I've also seen how the Trump administration has used emergency declarations for fairly perverse purposes. And so I don't know that I think it's the powerful tool that it once used to be for a number of reasons. And so I wouldn't be against it, but I also wouldn't rely upon it as the answer, the solution to mobilize the resources.
It doesn't feel like a lever that will actually galvanize meaningful action.
Not to me, and not in this particular moment. If you'd asked me the same question 5 years ago, I would have given you a different answer.
I'm a slight optimist in this one. First of all, our country notwithstanding, right? There is a big global movement. If you go to, they call the Conference of Partners, COP. COP28 declare climate and health as the first time recognized a health issue. And this is having all heads of state together. And they have a health day. COP30, which is in Brazil, actually put forward a whole action plan that all countries agree to. In G20, Brazil also, there's an action plan. I do think it matters because when people put a high enough priority, just like everything else, you need to at least make commitments and action. For example, every country have a climate national plan. They need to incorporate health into a climate national plan. So those plans do exist. You put climate in there. So actually, I do think this makes a difference, even though she doesn't feel the same way because where we are living in our country. But I do think internationally, there's a movement out there that recognizing this as an existential threat. There's no question about this.
You mentioned notwithstanding our country. I mean, I think it's safe to say that everyone understands that the Trump administration has taken many steps to move away from renewable energy and to increase the use of fossil fuels and coal and pushing back. They also undid the so-called endangerment finding, the 2009 finding that specifically said that 9 or 6, 7, or 8 greenhouse gases were a threat to human health. Does that not make it also very, very difficult in the United States to try to be making an argument that you're making, Victor?
Okay, so you're just hitting us, what do you call it, a spot anyway, because we've been well deep into this area at national academies. 3 things, right? One is, you mentioned the EPA rescinding, where the greenhouse gas has a harmful effect. They asked for a comment period. We actually immediately jump into action, do a quick report to say the last report on this was back in about 10 years ago. Let's do an update. We did. No surprise. Our evidence shows it's harmful. So we published this, and we got a lot of flack from both Congress as well as from administration. To the extent we asked, who asked you to do the study? We didn't. And who support your study, the implication, we don't agree, you have conflict. And so that was the beginning part of this. Not too long ago, the Judicial Center have a reference manual for all judges, look at different areas. There's a chapter in climate change we wrote. There are a number of AGs, should we say, in states that have asked it to be removed. They have removed it, but we would not remove it from us. We're getting a lot of flack on this one, a lot of flack. I mean, public flag, shall we say government flag about why they're funding us or using taxpayer money appropriately. We're now doing a really important study called attribution, looking at where the major sources are, and it's going to be highly controversial because lawsuits are getting ready to say, okay, you say it's from other industry, we don't agree, you're biased, the whole tobacco agreement, right? So we've already been contacted by Congress to say, what's the status, who's on your committee? So this is a hard issue altogether that we're dealing with.
Right.
But we're going to keep going because we believe in this, as Lisa said, equity and the right thing to do.
I do want to pivot back to what you were mentioning before, Victor, which is this understanding by the healthcare industry that in and of itself, even as you are doing all of these things to try to help people, the healthcare industry is not the most efficient in the world. I think anyone that has been in a hospital or a medical setting understands that there is an enormous amount of waste. The lights are on all the time. The air conditioning is running constantly. Lisa, does that strike you as, another fertile ground for trying to move the needle in a meaningful way?
Well, I want to build on something that Victor has said a number of times. Because, yes, the air conditioning and the lights and all that, but the bigger issue is that of all the chronic disease and the burden of that on our country and our health systems, we live in a sick system. We do not live in a well system. And in a sick system, where what we're constantly coming up with is new therapeutics, new drugs to treat whatever new diseases are coming along, we generate more waste in the process. If only an ounce of prevention is worth a pound of cure. If only we as a country would actually invest in prevention. That, to me, is the climate solution for healthcare, is that what we want is we want a healthy population that doesn't have to access this much healthcare to begin with. That is the far better solution to this problem. And yes, there are other things that we can do around facilities that feel more tangible to folks, but that, to me, will be a drop in the bucket. As Victor was mentioning, 80% of our emissions, it doesn't come from the facilities itself. It comes from all the products that we are constantly producing to treat an unhealthy population. That's where we need to invest our energy.
So if you simply bring the disease burden down broadly, we'll be doing less of this inefficient stuff.
Correct.
Yeah. I agree, by the way, totally agree. But there are some things that's good we take action because our responsibility, right? So for example, outpatient visits. During COVID-19, we turned virtual. The data shows that about 70% outpatient routine visits can be done virtually. Telemedicine is one way to solve this problem. I always tell the story, I used to work at Harvard, Longwood area. We have 3 hospitals and all the research facilities, right? So you have Children's Hospital, Brigham Women's, Beth Israel, you name it. And if you just drive around from one street to the other, it takes half an hour.
Right.
Patients have come in miles to drive in. The emission of transportation is huge to begin with, right? So I think creating a sustainable, resilient healthcare is important. That's good for the patient outcome. It's good for climate. So I agree with you. It's a small piece. It's really an important piece because we change the way we manage patients. People talk about entire value chain of healthcare, right? Going from very beginning, prevention, to all the way through technology, device, you name it. I think we need to look very carefully at those issues and how do we actually move this forward together. It's better outcome altogether. Also reduces emission.
I mean, it is, what you were saying before, Victor, that it is, I can't remember the exact percentage of America's greenhouse gas emissions, but it's a not insignificant amount. I mean, I think it's more than all the airplane flying that we do all over the country.
8.5%.
I mean, that is, if you carved American healthcare out into its own nation, that would be an enormous polluter that we would be jumping all over to try to do something about.
Yeah, it ranks among, I think, for healthcare, health sector, globally, it's 5%. It ranks among the top 5 countries, I think, in emission.
We are a sick system.
Yeah, that's why I say collective work globally is important. It's not just US, it's everywhere, right? That's why those things I think they do matter in trying to work together in that direction.
In a little bit, we're going to open this up to questions. So think about things that you'd be curious to ask these two about. I have plenty more things I want to touch on. But Lisa, on this issue of trying to make a system more efficient, you are a practicing doctor. If your administrator came to you and said, we would like to do this more efficiently and we think it could be done XYZ way, do you think that there would be pushback? Maybe not you clearly understand the rationale for this. But as we were saying before, doctors have so much on their plate already. Does it feel like it's one more thing that your colleagues writ large don't want to deal with?
So I am very proud for the healthcare system where I'm at. I'm at Stanford Healthcare, and actually I just spoke with our sustainability director before I came here to talk about what our journey has been, to your point, that yes, we have a lot on our plates, but also doctors, nurses, those of us that work in hospital systems, we are powerful voices for change. In 2020, we got together with some students that were really distressed about climate change. We put together a symposium. Our CEO came along with other CEOs in the region, and it turned into this race to the top of who could do the best. And 6 years later, I was getting all these messages from CleanMed, which is this big conference for healthcare sustainability, that our CEO was on the stage telling everyone else, talk to your CEOs, talk about climate change. This is important. And where
That's
we are,
how change happens.
that's how change happens. And especially because to this point of there's massive healthcare worker burnout right now. But what I have seen in healthcare sustainability is that it is the remedy to burnout because it is mission aligned with what we as healthcare workers want to do, which is to take care of people, to take care of planet. It really reinfuses with a sense of purpose. And this is like a fairy tale, right? This doesn't happen everywhere, but there are, what I have seen time and again from other nurses and doctors that I've seen in other healthcare systems is that it starts with them. You do need some buy-in from the leadership at the top to really get somewhere, because the number one way to go nowhere is that you're just trying to toiling along in your system and you can't get anybody on board with you. But persistence also matters. And so what I've seen is where people are successful is where they keep at it, more people come into it, you have a conversation with leadership, but you kind of need both of those pieces. You need like people within the system that care, and you need leadership buy-in, but it is possible, and we are seeing more and more healthcare systems step up to do it.
Yeah, so to me, this is why organizing people together, come together, is so important, because it's about leadership, right? So, for example, people come together because they believe the same thing. Peer pressure works, and people work together. So I'm looking at, first our collaborative. I'm seeing Jackie Gerhardt, Jeff Thompson, Lisa, all part of our collaborative, which has something about 80 organizations, hundreds of people working together to say, how do we make a difference? You want to give them guidance how to do this. We have a journey map in which we allow supply chain, McKesson, Cardinal, you name it, all working together to say, how do we look at suppliers and how do we actually begin to have that journey? And for example, McKesson have this green standard to say, if you want our suppliers, you got to meet this green standard, right? So that's powerful. But with Jackie working on electronic health record, how to create sustainable healthcare with climate sustainability with electronic health record. Jeff is one of the pioneers in Gunson that started energy, net zero, transition energy. So people like this matters, as Stanford and others. So I think there are, in fact, a lot of movement. It's true, it's difficult. It's true they're doing a lot of things. Question is how to get everybody. So we've launched, with their help, a movement across the country called Accelerating Climate Change and Health Movement. We now have 700 hospitals, some 80-some organizations all signing up to say, let's work together. Now, eventually what you want to do is to be able to measure, are you making a difference? You want to make commitments.
That seems critical to understand
exactly.
a benchmark.
Accountability, you name it, right? So that's the direction you're going. Another example, hospitals now saying, and our collaborative, along with others, are saying, you know, if that much emissions coming from supply chain, shouldn't we have procurement standards, right? If I'm going to buy from you, we're the one biggest purchaser, would you tell me what you're doing in this area? And so I think the movement's happening. It will take a long time, but I think, as Lisa said, there's leadership out there, and it's happening.
Lastly, before we open up to questions, I would just love a sense from you, Lisa. If we were to come here again in 5 years and have this conversation again, what are the things that you would like to be able to say, this is how we moved the ball down the field, to say we've had some success?
Yeah, and building off of what Victor was just saying, you know, we've also seen, so our organization brings together 58 medical societies. We're in 30 states. We have climate and health groups in 30 states where we're working on local and state policy. And then we've trained 50 plus physicians underrepresented in medicine to be leaders in their communities, to really be responsive to what their community needs. One of the things that we've been thinking a lot about is that do we need to bring more and more people in, or do we need to further activate the people that are already with us? Because one of the things that I've noticed, and we noticed this a few years ago with the 2022 Health and Human Sectors Pledge that was put out by HHS, is that healthcare systems would sign the pledge, and then they're like, did it? I'm just going to sit back, you know? And so it's one thing to get people to sign up. It is completely another to get them to actually act on what they committed to. And so we are kind of rethinking our strategy a little bit, especially because of the political climate we're in. It is frankly a little harder to recruit new folks to come in. So I would say we have a pretty powerful coalition right now. How can we take that coalition? And what I would like to see, and Victor has mentioned this, is that health and equity are front and center in climate policy. These two things are not separated. As we are thinking about climate policy, health is a piece of it. And one piece I will raise that has become a huge issue are data centers, where the focus is, you know, we want to do this as fast as we can. We live in this big country. We will use all the resources we need. How can we attach health and equity to the frame of how we do a data center build out, for example? Yeah. But we can apply that across any policy sector you can name that is probably represented at Ideas.
Boy, we didn't talk about AI, did we? Let's save it for
another
Q&A.
panel.
But 5 years. You know, you see my gray hair, just like Jeff. We're brothers. I've been around for a long time, seeing healthcare. The one that I feel that is most impactful is back in 1999, 98, we wrote a report to As Human Academy, where we say people are dying from medical errors, right? So I remember a young man, myself, sitting and saying, oh, we don't do anything like this. Then starts coming in to say, executive order, hospital to say, you need to reduce the medical errors, you need to improve quality, you need to measure. Guess what? Joint Commission said, Medicare, we're going to measure you. That's where we need to get to. Don Berwick, who started this movement, which is why we're starting this movement, because he started a movement, 100,000 Lives campaign, called Waste No Will. Anybody who's interested, let's join. Then over time, let's be more systematic. 5 years, I'd like to see people measuring it, being accountable for it, and the system itself acting like a system in patient quality and safety, likewise. So that's 5 years. Now, we're just beginning this journey. The Joint Commission, John Perlin, who's a member of our collaborative, because he was part of the collaborative, he said they started certification of hospitals. Hospitals not ready to be accredited, certified, but I think over time, people will do so. CMI under Liz Fowler started a thing called Teams, where they were going to measure emission and look at payment. Now with new administration, you can imagine where it's going. But I think that's the direction we need to go. Until you get to the level, it's voluntary, and it's not going to be systematic. But if you look at our country, go to any hospital, you can say, checking your wristband, your age, left side, right side. I think we need to get to that place. Second, I 100% agree with Lisa, health in all policies. That's what we're working on. The systems transformation work led by Judy Roden, previous Rockefeller Foundation head, and Howard Frumkin are leading this whole initiative, which the report will be out by early next year.
It's great. Do we have any questions from the audience? Yes, right here. Hang on. We'll bring a mic over to you.
Thank you. Hello. Thank you all for the talk today. I wrote down my question. So when we talk about movement building via coalitions, community voice and presence is often left out or flat out ignored. So how is your coalition centering community voice and, more importantly, sharing power by providing a seat at the table with the coalition?
Such a good question. Who wants to
if I can take first. No, they're not left at all. One of our 5 pillars, one of them is totally community. What we did is we worked with Jacoby Wilson at Maryland, look at mapping for the whole country, where all the hotspots are. We went to those communities and asked community-based organizations working there, right? You can imagine there are lots of people who can be doing this. So we brought them together. We brought strategic partners, which are funders, foundations, agencies to help them create a plan. We have a community action plan for each of the areas. We now have a youth movement in the community, so we're working on it. You're right, it's got to be much bigger, right? It takes time, but we're not ignoring that at all. It's high on our priority.
Yeah, I would say, unfortunately, I do think that we are a drop in the bucket. It's central to what we both do, but there's so much more to do. And every time we work in cities like Detroit, Memphis, Fresno, Houston, and what we hear from a lot of the communities there is we needed health data. Can doctors and nurses show up and support us? And so part of the Climate Health and Equity Fellowship that we do is we started that with the National Medical Association, which is the nation's oldest association for Black physicians, with this idea that we need to build leadership in communities where they are getting representation for who represents them. And we're building it. It's not enough. It's quite slow, but it is something we're committed to as well. And I actually met someone else at the conference who was working with Black women who are often the caretakers in their communities and doing a lot of community surveying. And so one of the things that we were talking about is we as physicians, what we try really hard to do on the ground is not to lead, is to listen to what communities are asking for and show up with the skills that we can offer, which is often things like data or community talks or resources, but to really, and we can't always be perfect about it, but to make it our value that we are community-led and community-grounded.
Jackie has a question.
Yes.
Thank you. Thank you, Lisa and Victor, for your leadership and for listening to your communities as well. My question is around AI, since we haven't talked much about it, just because it's a passion of mine, and I think it's very interesting to talk around climate change with that. So you already mentioned the idea of data centers being something that could be horrible for the environment. I'm curious, other than that, what would you say are the number one or two things that are bad about AI for the environment, and then maybe one or two bright spots of how perhaps it'll help us think about chronic disease or other things?
What's coming up for us, and again, because we're in 30 states, it is frankly a little chaotic at this point because there are so many data centers that are being proposed in so many places, and the requests we are receiving from communities and those on the ground has become overwhelming. And part of it, it replicates a lot of really, frankly, abusive structures we've seen in the past of companies not disclosing who they are, pouring a lot of money in to bypass processes.
Non-disclosure agreements.
Non-disclosure agreements. The Trump administration is trying to pass a rule to fast-track permits for it. And so it is, to me, it's bringing about a lot of trauma for communities that have often felt like they don't have agency over what is going to happen in their communities. And that in and of itself is a health issue that we often don't recognize, right? Like the lack of agency over what happens to your communities or your health or your well-being is a very powerful determinant of health. But then there are the other issues. So there are the noise and the air pollution issues that happen when you go in to do that kind of construction. There's all the water that's being taken up in the process as well. And then the other thing that we're seeing is that we're seeing fast track for gas turbines or gas-powered energy that is going to ruin or worsen air quality. A child born today can already expect to breathe poorer air quality than all of us in this room enjoyed. And that is both because of the actions of this administration to prioritize the burning of fossil fuels, in addition to worsening wildfires that is erasing the gains that we saw from the Clean Air Act. So those are a few of the issues, but boy, we are on fire and we're working on it.
Victor, do you have an optimistic take on what?
I do indeed. I think AI is going to be a big part of a solution as well as recognizing the data center and the energy it emits, because AI is going to have so much information to help us make lots of decisions about energy sources, efficiency, clinical decisions to make. And she didn't tell one thing, they're working together on this regional health learning collaborative, going to multiple states to have frontline workers. The issue about that, Lisa mentioned, is that every region face different types of climate events. So you have to customize them as well. and then trying to figure out what to do in that area. Furthermore, we can also create frameworks that can inform systems. For example, at Mass General Brigham, they're starting with looking at what's happened in their region to all of Boston, all of Massachusetts to learn this. So all those things can make huge difference, and AI can make a huge difference in moving this forward. Question to be addressed, Jackie, is how do you actually address the bigger issue of emission, right? So we're going to have to figure out how to create that balance.
Yeah, and just to that point, I mean, the example I'd like to make is like we used to think that single-use plastics had no impact, right? Yes, there is a great possibility with AI, but we can't treat it as this like, we're just using it for free. We need to attach a decision calculus to say this is actually requires resources from us. How do we attach appropriate balance to where the advantages are and where the harms are and build systems that center community?
Mm-hmm. Yeah.
Great question. Anyone else?
Back there.
Yes.
Thank you. How are you working with Veronica, and I work with Baxter at a full disclosure manufacturing, a medical technology manufacturing company. How are you working with industry, especially as it relates to pharmaceutical, med tech, device, et cetera, to sort of bring coalition? Because we know we generate products that we sell to hospital systems who then use that product and potentially need to recycle or waste as a part of the full life cycle of a product. How best do you engage our industry, right, in that conversation?
For a collaborative, we have one working group totally with industry. And we're now pulling the industry group with a healthcare group to talk together to say how can we work with each other. But that group, by the way, that collaborative is co-chaired by Senator Bo Frist, Nim Jafara from McKesson, EVP, and myself. And we have actually almost all the industry involved, whether it's GSK, AstraZeneca, Medtronic, you name it. So there is, in fact, a lot of sustainability officers and CEOs involved. First thing we're doing is we have created what we call a journey map to say, if you are trying to start doing this, where do you need to be doing, what should you be doing? So that's out there. We also have action lists to say these are the key actions you can take because these are highest emitters. But more importantly is measurement. Right? How do you standardize measurements across industry? Right? How do you start reporting them? And then procurement. How do we as purchasers demand from industry where it should be? So for Baxter, I would imagine you're a big part of all the supply in medical equipment, and it will be part of that discussion, right? And I think everybody recognizes how important it is. Because when I think about the North Carolina flood, one time the IV fluids ran out, right? So I think the construction industry is big time,
Right.
with extreme weather. And if you ask young people who come and work at Baxter, they say they want to know what you're doing about climate change, right? So I think this is a win-win. And our collaborative, as you know, is doing a lot of work on this area.
Great. Anyone else? Yes.
Thank you so much. On this question of getting health back into the picture in how policy decisions are made, healthcare is very good about measuring. And now you're talking about also bringing in lived experience, people's perspectives, so that we count, we measure how many lives affected, and so on. But policy in this moment does not seem to be being made based on decisions of data and evidence and how many people are impacted. So could you reflect a little bit on, are there other pathways? I know you talked about the youth movement a little bit, but are there other things that are maybe staring us in the face that we're missing because policy decisions don't get made based on the way we were trained to support making them?
We've pivoted a lot of our strategy to focusing on the judiciary because that's where we see, for example, in December, the EPA stopped counting health in its regulations, saying the only thing it would count is the cost to industry. So basically, our health is erased from the calculation. So they're being sued, and we are writing an amicus brief, not on this issue, but on the endangerment finding on behalf of youth. And you think about where your levers are on a federal level in terms of the executive or Congress or judiciary. Our feeling is that it is the judiciary in the next couple of years, and this is where we are training our health professional network to provide expert testimony, to write amicus briefs, and show up in those spaces, because that is where we see the greatest opportunity to at least protect. And we got to protect what we have, and then there are many policy shops that have started to build. I'm a part of the Thriving Economies Project, as is Jeff Thompson. That's building a policy blueprint for when we're in that space where we can rebuild. So we've got to be doing both things at once, defending what we have and building towards the future.
Yeah, I would say that we'd love to believe that policies are informed by evidence, and that's what we do. So we keep providing evidence. But we recognize that's simply not enough, right? First of all, we need to better communicate, because we tend to show bar graphs and numbers versus patient stories, as you heard, right? But secondly, I think you need to understand the politicians, what drives them, what kind of decisions they're making, and why. Because unless you understand that and you have a narrative with them, nothing's going to change. They're just going to be out there speaking loud, right? So you need to think about this. Third is think about coalition, where the powerful, in Washington, it's all about lobbying. Well, we can lobby, but it's all about how you influence policy through the many voices that have, interest for politicians. And then don't forget the state and regional level. There's a lot of decision being made there. There you can make a lot more difference by being able to speak to them, looking at long-term, what their long-term goals are, aspiration, short-term, and how you can help them.
I'm sorry, we don't have time for any more questions, but thank you all for being here.
I do want to ask them, how can we get you more excited about this? Or at least more worried? Because we need your voice, right? I mean, some of us are working so hard on this issue, and many people are working on it, but I think the public needs to know this.
Yeah, my grades are catching up. I'm not there, but I'm getting
Me too. Me too.
You're not there yet.
This is also being recorded for a science program that we do at PBS called Horizons. And that's it for this episode of Horizons. Thank you so much for watching. We'll see you next week.